Okay, welcome back. We are wrapping up our summit today, but prior to that, I want to introduce Imani Nunley, who is the Asthma Program Coordinator with the Marion County Health Department. Imani graduated with her Bachelor of Science from Mississippi University for Women in Public Health and is currently pursuing her nursing degree at Marion University. After spending 4 years in infectious disease as an STD and HIV testing and prevention manager, she figured it was time to shift gears in her career and switch to chronic disease. She now serves as the Asthma Program Coordinator at Marion County Public Health Department, working to rebuild the program in an effort to combat high, poorly controlled asthma rates within Marion County. In her free time, she enjoys spending time with her son and close family and friends, cheering on the Colts and do-it-yourself projects. Welcome, Imani.
Imani, it looks like you're muted.
Can you guys hear me now?
Yes, ma'am.
Okay. So I want to take the time to say thank you for this amazing opportunity that you guys have given me to speak before this great group of people. The presentations have really just been awesome today, and I have learned so much. And so I just wanted to briefly share with you what I have going on with my asthma program. I just have 10 minutes, so this is probably going to be the shortest presentation that you guys see today. But you can go to the next slide. So this is the asthma referral program that I have been working on. And the Asthma Referral Program is also known as Breathe Easier Referral Program. It was established to provide environmental harm assessments for patients that have been diagnosed with poorly controlled asthma. And the goal is to identify and address triggers found within the homes. And we know some of the most common triggers are cockroaches and mold and things of that nature. And we aim to open a case to help patients progress from poorly controlled to well-controlled asthma. You can move to the next one. And part of what our services include is the great thing about it is everything is free. So we will provide environmental assessment, and we will provide education, which is known as asthma self-management education. We provide asthma toolkits, and in those toolkits, we include green cleaning supplies, allergen-free pillowcases, HEPA vacuums, food storage containers, and we do provide contact referral information for additional resources. One thing that we have noticed is when you're dealing with certain issues, some things are beyond our control. So if we are unable to really help resolve the issue that is found within a home, we will contact one of our partners for tobacco cessation, which is the chronic disease department. For indoor air quality, it's the indoor air quality department. And then we have pest control, and we can also help with those who do not have access to insurance. We can help them get enrolled in insurance through a department here at the health department, because we know that one of the biggest issues within Marion County and the rate of poorly controlled asthma is the health disparities that we are dealing with those who do not have easier access to health services. And we also provide trash cans with lead. So the referral program is really easy, basic, straight to the point. A health professional basically would diagnose a patient with poorly controlled asthma, and then they will make a referral through REDCap. And REDCap is the referral program that we use and prefer to use because it's easier for us to automatically collect data as far as who was sending in the referral, where it's coming from, how many we are receiving, when we are receiving them. And then once those referral comes in, we have environmental health specialists on our team who they will be alerted, and they will go in and check that referral, and they will reach out to the patient or the guardian or parent of that patient and they will work to schedule environmental harm assessment. And then from then on, we open a case. And once we open that case, our main goal is to make sure that we are helping them progress from poorly controlled asthma to well controlled. And when we think of poorly controlled, we think of those who are frequently in the emergency room, who are having frequent asthma flare-ups or asthma attacks, or being hospitalized at a higher rate than normal. So those are the cases and the audience that we are targeting. We're not really doing any services with those who are considered well controlled. You can go to the next slide. And to access the referral, there will be a link stand. So the way this works is once we set up a partnership or it's a collaboration, or we work with a health clinic, we will provide this link for you guys, and you guys can save this link. You can share it with other organizations across the county. And it can also be found on our website. So if you guys need that information, I know that Courtney is allowing everyone to access the presentation. So if you need that information, please feel free to go back to my presentation to get this information. The next slide. So the importance of the environmental health assessments are, we know that clinical assessments are happening, but it's not often that the environmental side is being handled as well. And it only focuses, the clinical assessments only focus on the clinical perspective of asthmatic patients. It does not address the triggers patients are faced with when they return home. If those concerns are not addressed, poorly controlled asthma will not be resolved. According to CDC, environmental harm assessments coupled with clinical assessments showed a decrease in poorly controlled asthmatic patients. So you were seeing less hospitalizations, less visits to the emergency room, and less asthma attacks or flare-ups. And on this next slide, I just wanted to kind of provide like a snapshot of one of the studies that was completed in Seattle at one of the Healthy Home projects. And I thought it was very unique. It is one of the goals that I am actually working towards with my program. Because even though we have revamped in 2018 and we have made great strides, we still have ways to go. So I just wanted to kind of provide a little snapshot of a research that was done. And I also provided the source information. So if you guys wanted to go and look at that research yourself for more in-depth information, you're more than welcome to. But at baseline, it showed, I had the wrong number, it's not 214, but at baseline, there was 274 low-income children between the ages of 4 and 12 that participated in this study. And the study went on for 1 year. And at least 3/4 of the home, there was at least one trigger found. And about 36 of the home, there was at least 2 triggers found. So just to make it short, the results of that is 214 of them actually completed the entire program for that year, which is about 78%. They reported significant changes in behavior through education. And education is definitely a huge piece. One thing that we were seeing, especially with my conversations from nurses, is that patients weren't really aware or educated on the medications that they were taking. They weren't educated on the environmental triggers that were found in their home, so they wasn't doing anything about it. And there was also a decrease in asthma symptoms every day. So they were able to reduce exposure to different triggers in their surroundings. There was an increase in quality of life, and there was a decrease in exposure to triggers. So that is what I have for you guys. And Cindy, I just saw your question. So our entire organization has been experiencing some type of outage. I really cannot explain it. It's been going on for a couple of weeks now. So it's been really hard to access anything. That is actually why I'm home doing this presentation, because we've just been able to access anything internally. So what I can do is provide direct contact information for our environmental health specialists for those who are needing to send referrals directly to us. So I would send an email or a phone number, and for now, that'll be the way that you can get in touch with us. And once everything is resolved within our organization, I will be sure to let everyone know. So with that being said, I really hope to hear from you guys. You guys are definitely going to hear from me, because I've seen some amazing things and some amazing opportunities on how we can all work together. As Nadia mentioned in her presentation, it takes teamwork. We all are fighting a common goal, and we all offer something, you know, in some way. And when it all comes together, we can do so many things. So be on the lookout to hear from me, and I hope to hear from you guys to see how we can work together and, you know, get things done. So I really thank you again for this opportunity, and I hope you guys enjoyed it.
Thank you so much, Imani. I appreciate you being here today and explaining some of what you're doing as far as infrastructure for asthma in the state. I hope that today's summit has been informative and helpful, that you found some resources to help you navigate asthma in Indiana, whether that was gaining a better understanding of the 2021 Global Initiative for Asthma Guidelines that will help you help your patients, or maybe you learned about how the environment in our homes affects asthma and how important it is to prevent mold. And where we live does affect our health. Living in Indiana with asthma can be challenging due to many reasons, including, but not limited to, accessing resources, finding the right healthcare provider, learning to correctly use multiple medications to control asthma. And that can be a lot, especially when you're struggling to breathe. I know this because I have asthma. And when I think of the work that impacts asthma in Indiana, I am so proud to be the lead of the Indiana Joint Asthma Coalition and to work with our coalition members and our partners at the State Department of Health as we all work to reduce the burden of asthma in Indiana. The Indiana Joint Asthma Coalition has been impacting asthma in Indiana since it was first established in 2003. And they've done that by coordinating the development and implementation of the strategic plan for addressing asthma in the state, by providing asthma-related trainings and presentations within Indiana to healthcare professionals, schools, nonprofit organizations, hospitals, local health departments, and partner agencies. Also, by working cooperatively and constructively with the Indiana Asthma Program at the Indiana State Department of Health, as well as other state agencies. And also increasing public awareness of asthma as a serious chronic illness, and improving the knowledge and skills of patients regarding detection, treatment, and control of asthma, particularly among high-risk populations. I invite you to join the Indiana Asthma Coalition as we continue to move forward in our goals of reducing the burden of asthma in our state. You'll find my email in your summit agenda, as well as a link to join the coalition if you'd like to find out more. A couple of housekeeping items. You received an email with a link to fill out the Asthma Summit hard copy resource request form. So please fill that out so that we can ensure you get the resources that you want. And then you'll also receive a link via email for a survey, a Qualtrics survey about the Asthma Summit. So I ask that you please take a minute to fill that out. You will also receive a certificate of participation through email as well. Last, but certainly not least, I want to re-welcome Dr. Nadia Krupp to close out the summit for us. Thank you, Nadia.
All right. Thank you, Courtney. I am really excited about what we heard today. Honestly, I've learned from almost all of the speakers. I was trying to bounce between all of them because all of the topics were interesting. And I think it's given everybody some food for thought and some potential opportunities and ideas for how we can move forward from here. So I'm really hoping that we will continue to reach out to each other, identify new partners out in the community or within the healthcare field, within the patient population that we serve, and keep moving forward to decrease the burden of asthma throughout the state of Indiana as humanly possible. I am always available for questions. I will put my email address again in the chat in case anybody needs it. And if I don't know the answer, then I am happy to try to connect you with somebody who does. And so with that, I think we are ending a few minutes early. But if there are any final questions or comments or thoughts that people have before we leave, either for me or anyone else, then we have a few minutes to answer those. So thank you, everybody.
Thank you so much, Nadia. And thank you to everybody for being here today. These are some of the people that were on our Asthma Summit planning work group that helped put all of this together. So extra special thanks to everyone listed here for making this come together. Much appreciated.
One last thing I did want to say is that we are hoping to make this Asthma Summit and potentially an annual event. So if you have thoughts going forward about what you would want to hear about the next time we do this, either virtually or perhaps in person at some point when COVID is over, or some combination thereof, then please reach out to one of us and we will try to find good speakers and good content to answer that question or to explore that idea some more.
All right, thanks everyone. Feel free to go through your resources. If you have follow-up questions, you can contact me and I will connect you with whoever you need to speak with or try to get the contact information for you. Thanks again and have a great day.